I'm Karen Green. I'm the radiology charge nurse at Area Health in Philadelphia, Pennsylvania. Interventional radiology performs an increasingly number of minimally invasive procedures on our patients. Utilizing capnography along with moderate sedation allows us to provide safe patient care, have our patients experience a positive outcome, and also have a much more pleasant experience. We tend to place our patients prone for some procedures such as venous lysis or for biopsies. Depending on the patient and their ability to actually move their head and neck to turn it to their side, patients can end up rebreathing their CO2. So we're looking at how the pillows are placed, how the patient's head is positioned or their face is positioned, so that we are eliminating that component. You need to be familiar with the current literature. Network along with your colleagues and other professionals so you can understand what is happening. It's also critical to discuss the positive effects of capnography related to patient safety, in that capnography will allow the individual to monitor the effectiveness of that patient's breathing. It's critical that nurses be at the table, having these discussions alongside of anesthesia, administration, and other physicians. We need to learn to speak as nurses in financial terms, not just in patient safety terms. The Joint Commission, in their 2011 Provision of Care statements, acknowledged the fact that hospitals should monitor their patients during operative or high-risk procedures, and also during the administration of moderate or deep sedation. And those parameters apply in any setting, so it doesn't matter if you're interventional radiology, the cath lab, or the emergency department. ARIN, the Association for Radiologic and Imaging Nursing, also has published documents. We have a clinical practice guideline related to moderate sedation and anesthesia that was written in 2009 that states that the nurse's assessment should include measuring the patient's ventilatory status along with other parameters. Prior to capnography use here at the hospital, you never would realize what you were missing. And now that you have the technology, you're better able to determine the patient's ventilatory status, how they truly are capturing that gas exchange down at the alveolar level, which is where everything happens. And so when you look at the patient and how well they are, how well they're comfortable, are they in pain or are they having any kind of anxiety, you can better pick that up when you're watching the waveforms. So I think when you put it all together, it's a much more safer way of taking care of patients. They understand that it's for their safety that we're utilizing this technology. We also explain to our PCA patients that they need to wear the cannula in order for us to continue utilizing the PCA medication for them. And so overall, we have great patient compliance.